All right, Iman Abuzeid, MD, is the co-founder and CEO of Incredible Health. It's the largest career marketplace for permanent healthcare workers. The AI-powered platform's custom matching tech aids health systems to hire qualified permanent nurses and technicians. Company's raised $100 million dollars and is now valued at 1.65 billion dollars. And Iman, it's great to have you here and welcome to RecTech.
Thank you so much for having me, Chris. Appreciate it.
Awesome. Looking forward to the conversation from today. So give us a brief history of the company. When did you start it, and what was sort of the impetus behind all this? And give us some of the origin story there.
Sure. And I'll start with myself. Um, as you mentioned, my name's Iman. I'm an MD by background. I don't practice at all. I've been in software for the last 12 years of my career. So I grew up outside of the US. I immigrated to the United States when I was 24 years old. I worked in management consulting, doing like hospital operations and strategy work.
Hmm.
Then did my MBA at Wharton, and then moved out to the San Francisco Bay Area. And that's really when I got involved in startups. I was a product manager. I worked in early stage healthcare technology companies. That's actually where I met my co-founder, Rome Portlock. He's a software engineer from MIT. Um,
Oh, great.
and so we worked together as engineer and product manager, like employees for several years before leaving to start and found Incredible Health. A lot of my family members and friends are doctors and surgeons and they that are practicing, and they're often complaining about understaffing. At the same time, my co-founder Rome has many family members who are nurses, and they were saying I'm experienced and I'm qualified and I apply to 10 places and I usually don't hear back. And we were like, okay, this is interesting because both sides are sort of kind of complaining about the challenge. So we started to dig into it and we uncovered that, healthcare is the biggest labor sector in the country by number of workers. It's also the sector with the largest labor shortages. Like our demand for healthcare keeps increasing as our population ages, but we've increased the number of healthcare workers in the country, but it's still not enough to keep up with the demand. And so there's massive shortages. And so we were like, shouldn't everyone be hired like very rapidly? And so we started to dig into it and we uncovered that the processes, the tools, the technology, even the mindset, like a lot hasn't changed in over 20 years when it comes to hiring in healthcare. And we just figured there has to be an easier way. And so fast forward, we created this company, Incredible Health, and this product, which is a two-sided career marketplace for healthcare workers. We now work with 1,500 employers across the US, including very big health systems like Tenet Health and Trinity Health and Kaiser Permanente. We also work with regional systems like Baylor Scott and White and Wellstar. And we also work with many academic medical centers like Johns Hopkins and New York Presbyterian and NYU and so on. And we've also expanded to over 1 million US nurses on the platform as well. And
1 million US nurses.
over 1 million US
Wow.
nurses. So one in three US nurses uses Incredible Health to manage their careers.
Okay.
Um, so that's
So
the,
there's
yeah,
about 3 million nurses overall.
exactly. Yeah.
Gotcha.
Yep. And so some of the results that we've been able to drive include more rapid hiring. So hiring that happens in 20 days or less instead of 60, 70, 80 days. We've also been able to drive cost savings for the organizations we work with. So at least $5 million saved per facility because they can reduce their temporary labor, overtime costs, incentive pay costs by hiring permanent workers faster.
Mhm.
We've also been able to just drive a lot of dream opportunities for the healthcare workers too. We often hear, I use Incredible Health to find my dream job. We've had nurses relocate to other geographies. We've had them get higher pay. We've helped them advance their careers, expand their skills. And so ultimately, the way the product works is just a few key things to just point out. Number one is we've automated the screening of the talent. We've also automated the matching. Um, we've also introduced a lot of AI features and AI agents, which we can spend more time on as well. All of that's just to help both parties connect more efficiently and more effectively so they can find each other quickly and get hired.
Awesome. And I think you have a way where employers apply to interview healthcare members, right? So that's kind of a reverse way of doing this. It's really interesting to me. I love the premise of that. So walk us through about kind of how that works a little bit, if you could.
Sure. So, sort of our claim to fame, and when we started back in 2017 and 18, is that the employers apply to the healthcare workers instead of the other way around. As you can imagine, the healthcare workers absolutely love that. They create a profile, they sit back and relax, they get interview requests from different employers, they get to choose which interviews to accept or decline. It really gives the healthcare workers a feeling of being a little more in control of their careers. And then for the employers, they like it too because they're like, I'm going after exactly who we need. This has been particularly effective, especially for the experienced nurses, those that are specialized. These are some really highly sought after candidates. And so that model has worked well. And to be honest, like we got away with that kind of model because of the shortage, right? If
Yeah,
it wasn't a labor shortage, I don't think we would have been able to do that reverse model where employers are applying to the healthcare workers instead of the other way around.
interesting. So if I'm an experienced nurse, I go on your platform today. I create a profile, assume, and maybe you screen me as well. How quickly do I get my first interview request? Like, give me a sense of that.
Yeah, that usually happens same day.
Same day.
Yep, exactly. So you're screened using our automation. We also have a little, some humans involved in the screening too, because we've integrated with so many databases to be able to do that in a more automated way. And then we've also, and then the matching algorithms is what we've built as well. So it's a customized experience or personalized experience for each individual nurse and for each employer too.
Yep.
And so you only get interview requests that are relevant for you. And then as a nurse, you get to decide which interviews you want to accept and which ones you want to decline.
Very cool. All right. So you're about what, 7, 8 years in now, you said?
Yeah. Yeah.
What was it like in the early days there of just building a marketplace here? Because you have to attract the employers and the talent. What did you concentrate on one thing first? Like, did you build up a pool of nurses first, or walk me through how you did that, if you could?
Yeah, sure. The early days of building the two-sided marketplace was definitely like a chicken and egg problem, right? Like you have to get both. What the main tactic we did at the time is we did concentrate on both, on increasing the number of employers and increasing the number of healthcare workers. But what we did is just limit the geography. So in our early days, we were only in the Bay Area, right? Then
Oh,
we added LA, then we added Dallas and et cetera. So this was definitely a geographic expansion over the last 8 years across the entire country. We now cover like 60, like 70%, I believe, of the US metros are covered by Incredible Health. And that's how we were able to also just get to the numbers that we've gotten to of 1,500 healthcare employers, including acute care hospitals, but also now surgery centers and home health organizations too.
hmm.
And then we've also expanded to over 1 million nurses, and we now have technicians and other allied health professions on the platform as well.
Yep. You must have pretty good word of mouth too, like in terms of just referrals from your existing nurses and stuff, right?
That's right. When it came to just getting the nurses on the platform and acquiring them and keeping them engaged, it was definitely like a multifaceted like strategy that we used. Certainly, what word of mouth was an important part, but we also provide a lot of free tools and services to the nurses too. So, for example, we offer continuing education in our apps. We have free salary estimators. We have a community where they can engage with each other. We now have this AI voice agent named Gale, named after Florence Nightingale, that helps them with interview preparation and helps them use AI to generate high quality resumes. So it's more than just like finding a job, it's really the place where they're managing their career. And so that allows us to not only acquire nurses to join the platform, but also keep them engaged so employers can hire them too.
Yeah. All right. So you had an announcement recently about the new AI agents saying they're going to transform the economics of healthcare hiring. So explain that if you could, and maybe we can show them off a little bit here too on the screen if you feel
Sure.
so.
Yeah, absolutely. So we've been adding AI features and technology since ChatGPT came out. So since December 2023, we were actually the first career marketplace in healthcare to add AI. And we've added so many AI features now. We call that sort of suite of features and products Incredible AI. Most recently, what we've launched are two AI voice agents. Um, the first one is named Gale, named after Florence Nightingale. Gale is a lifelong career partner for healthcare workers. Uh, Gale helps healthcare workers prepare for interviews, does mock interviews with them. We uncovered in our research that 30% of nurses start their job search without a high quality resume, and that's happening even outside of Incredible Health. which means they're essentially can't enter any organization or enter any job search experience with an organization. And so now Gale helps them generate a high quality resume using AI. Those are just a few examples of what Gale does for them. Essentially, what Gale is trying to do is help nurses uh, enter their, hiring experiences with more confidence and more competence.
Mhm.
They're even more successful when they start engaging with employers directly. Um, and that is just part of our ongoing vision and mission of helping healthcare professionals live better lives and helping them find and do their best work. In addition, we have an AI voice agent named Lyn, named after Marilyn Gaston. Marilyn Gaston was a physician researcher who did a lot of work in sickle cell anemia, so that's who Lyn is named after. You can think of Lyn as a co-pilot for talent acquisition teams. Lyn is an AI voice agent that interviews the candidates, verifies their credentials and qualifications, and even sells the employee value proposition of specific organizations to them as well. Uh,
Really?
yeah, and so really what we're trying to do with Lyn is just drive even more speed, quality, and cost in the hiring experience. Um, so
How are the nurses reacting to that? Like, because
yeah,
this whole voice AI thing is fairly new to the market, right? I'm seeing different stories about, yeah, I hate it, I like it. What are they telling you directly about
yeah.
it?
So we have already have some data on this. W where the data is coming from. So Gale has been live for many months and Lynn as well. And we don't believe in building products on our own. We always collaborate with our customers. So in the topic for Lynn, for example, our design and development partners were five health systems. So Sutter Health in California, Baylor Scott and White in Texas, um, New York Presbyterian in New York, Johns Hopkins in Maryland, and then Tenet Health, which covers 10 states. So those health systems were our design and development partners. And so we were able to get some initial data too. So for Gale, 90% of nurses give Gale a thumbs up and would recommend it to their peers.
Hmm.
Um, we dug into why. Why is it that nurses, including experienced and qualified nurses that are highly sought after, why are they giving Gale, good reviews? It comes down to two main reasons. Number one is that they love the 24/7 convenience of an AI voice agent. We've seen interview preparation sessions and resume creation and so on happen at midnight on Sundays, like way outside of business hours. And as we all know, like nurses are some of the most overworked workers in this country. They're often not just working, but overworking while considering their next role. And so they really value the convenience of the AI agents. The second thing that they said is that they feel less nervous interacting with an AI voice agent
Less nervous. Okay.
than with a human. There's a feeling, there's a sensation that humans are more likely to judge, which we are, whereas an AI voice agent, which is effectively a robot, is not likely to judge. And so they end up sharing, because we have human interview preparation as well. And
Yeah.
so we actually see that even more information and more is being shared with the AI voice agent than with the human. So that was a very interesting finding. And we're getting these findings across all generations. This isn't just like a Gen Z millennial phenomenon. Even the older generations are reacting in this way too. Um, so we just found that to be sort of counterintuitive. It definitely surprised me personally.
Mhm.
But I guess that bodes well for I guess the future of AI technology and how healthcare workers will respond to it.
Yeah.
Hey, I'm Lynn, your AI career partner. Am I speaking with Jen Lupton?
Yes, you are.
Great, thank you. I'm an AI recruiter with Incredible Health, working on behalf of Wellstar to fill an operating room RN role at Wellstar Cobb Hospital. In this call, we'll discuss your experience, confirm your qualifications and preferences, review the role, and I'll answer any questions you may have. If there's something I can't answer, I'll note your question down for the recruiter to review. Does that sound good?
Yes, that sounds great.
Before we get into role specifics, I'd love to learn more about your background. I see you have experience in the operating room at Northside Hospital and Emory University Hospital. Can you tell me more about that experience?
Sure. I've been working in the OR for the last 4 years. In my current role, I mainly circulate, but I occasionally scrub in as well. I handle a wide range of procedures, and as a circulator, I prep the room, I perform timeouts, and I document throughout the case.
Thank you for sharing. Why are you looking for a new role?
I've had a great experience in my current role and built a great foundation as an OR nurse, but I'm looking for an opportunity where I can keep building and growing my skills, expanding my skills, and potentially considering leadership as well. And would love to sort of be in a slightly larger organization so I can do that.
Thank you for that information. Can you
So with that in place, then what's the role here for the human recruiter, like, and hiring managers in this process? Like, where does that human in the loop, in your opinion, come in?
Yeah, I think the human piece is still really important. The way we're thinking about Lynn is that it affects speed, quality, and cost, right? So on the speed side, the average number of days on our marketplace, and even outside of our marketplace, I think to complete a phone screen with a human recruiter is about 4 business days.
Okay.
By the way, that's not bad, right? Uh,
No.
4 days from applying and getting your phone screen completed is good. But because Lynn is available 24/7, now those interviews can happen same day or right as soon as the application is submitted, right? So really, it's a 20% reduction in hiring timelines. Um,
And
uh,
are these quick phone screens, or are they more of an interview itself?
they're
Describe
more of
the
an interview.
length of these. The
Yeah,
what?
they're like 10 to 15 minutes.
10 to
They're not,
15. Okay.
yeah. On the quality side, I think what's unique about this is that today human recruiters, just because of their own bandwidth, maybe they're able to engage live with 5 to 10% of applicants. Whereas with Lynn, because of the kind of unlimited nature of it and the fact that it's available 24/7, can now engage with all nurse applicants. Um, so that's another huge impact on the candidate experience. That instead of just getting a rejection email or not interacting with the employer at all, you can actually engage with the AI voice agent Lynn. And not only can you be interviewed that way, but you can also find out more about the organization. You know, Lynn is trained to sell the organization, the employee value proposition, the benefits, the perks, the unique attributes. You can ask Lynn questions, et cetera, which is great. And then on the cost side, you mentioned the role of the recruiter. We sort of estimate that Lynn can save between 400 to 800 hours per year per nurse recruiter in a hospital setting. So that's about 1 to 2 months of time saved per year
Hmm.
for a nurse recruiter, which is meaningful. The way many leaders are thinking about this is that we've always dreamt that if recruiters could do more strategic work, that would be really helpful. So what do I mean by that? I'm referring to recruiters engaging with hiring managers, recruiters going on site, recruiters building long-term candidate pipelines instead of doing the work of instead of spending hours every day doing 5 to 10 phone screens. And so really it's just about a shift. We don't see this as, replacement or anything like that, right? It's more about shifting the role of the recruiter and their job descriptions. I honestly believe that AI technology is going to change all of our jobs, including mine, including yours. And it's not that any of our jobs are necessarily going away. It's just that they're going to change. What we do every day is going to change.
Yep.
That's how we're thinking about this. Um,
Nice.
in terms of just the process, to just go into like a little more detail. So Lynn is able to send messages to candidates using AI in a personalized manner to engage them. And so it's personalized to what the nurse is looking for and highlights the unique perks, attributes, and benefits of the employer. We've already seen that lead to a 20% increase in nurses agreeing to interview with an organization. After that, Lynn can do the live interview. Lynn is able to interview the candidates, verify the qualifications, and sell the employee value proposition. After that, Lynn creates a summary that a human recruiter can review. We are very sensitive to compliance and the various AI laws that are being published now. So already we're recording this in October of 2025. So like the states of New York, Texas, California, Illinois have already published state laws related to AI and hiring. And effectively, what those laws say is that AI cannot make hiring decisions. And so that definitely the state regulations influenced how we built Lynn. Um, essentially,
Okay.
Lynn,
So what does that look like for the recruiter then? If
yep,
you're just providing recommendations, like, at that
yeah.
point, are you scoring it all, or
So Lynn provides a summary of the interview, and it's a
summary?
structured summary.
Yep.
So the human recruiter can make a decision about whether the candidate should be dispositioned or move on to the next steps. So as a result, we're big believers of human in the loop, and the human recruiter on the employer side needs to make that decision.
Yeah.
But we just want to make sure that they're armed with making the decision. So Lynn does not do stack ranking, scoring, et cetera, but does provide a robust summary so the human can make the decision. We want to make sure we stay in compliance as well as all the, we're primarily working with large enterprise, these are enterprise healthcare employers. We want to make sure they stay in compliance too.
My AI is not perfect yet, so have you noticed any kind of just hiccups in the system here, like with the conversations happening between the AI and the candidates at all? Has anything happened there that you could speak to, or has it been pretty smooth so far?
It's been smooth, but I will say that like our product and engineering teams do spend like a lot of time on QA, on quality assurance. Some of the problems that we've already overcome include what happens when the candidate has an accent, right? Like doesn't necessarily sound American or English is a second language, and the AI agent needs to be able to handle that. But we've
Hmm.
also trained our AI agents in a way that sort of is optimized for completion. So let's say the answer is only like a 1 or 2 word answer, like that's not sufficient. So Lynn is trained to ask follow-up questions and get more information out of the candidate if the answers aren't complete. Um, so those are, just a few examples of some of the things that we've had to sort of overcome.
Gotcha. Very cool. And what's from your client base when you were doing the first testing with some of these five systems you mentioned? What was one piece of the most surprising feedback they gave you about just implementing this technology?
Yeah. So this implementation, of course, does require, and we definitely prefer an ATS integration. So I think the most important thing is to make sure that this fits into the workflows of the recruiters, their existing workflows, instead
Yep.
of having it be something separate. So that piece is important to figure out, and is honestly customized for each employer. Incredible Health also takes on the configuration and setup of Lynn. So employers have the chance to use behavioral, they can customize behavioral questions, clinical questions, how they want Lynn to discuss the benefits, the employee value prop, all of that's customizable, and we take on the work to do that, which is different, I think, from some other AI solutions. Also, like Lynn was trained on like over 1 million nurse profiles and like 8 years of hiring interactions. So we're like deep experts on hiring, and a lot of that was used to train Lynn, which is different from some other generic AI solutions that are applicable to multiple industries. This is a very specialized AI agent designed for nurses, and our roadmap has plans for Lynn to be operating on allied health professions and all of the clinical roles. We do think these roles are particularly unique. They're complex roles. They're not, say the catering services, janitorial services, and so on are lower complexity roles. But when it comes to the higher complexity clinical roles, a little more expertise is needed there, and a little more configuration is needed for the AI agents too.
Yep. Do you have a favorite success story about the product, maybe from a candidate or employer perspective?
I think my favorite story so far on the candidate side, really. I shared earlier that I was surprised by the sort of uptake of the healthcare employers and adoption of Lynn and Gale. It's been cool to see that such a wide variety of nurses across so many different specialties, a variety of geographies, a variety of ages and generations engaging with the AI voice agents. Um, and it just really highlighted the value of convenience. I mean, we sort of knew that, like one of our results is always on the speed side, which is also part of the employers applying to the healthcare workers and so on.
Hmm.
Like, speed's always been part of the incredible health value proposition, but the AI voice agents have taken the speed factor to the next level.
Yeah. What's your favorite feature?
Great question.
Hmm.
Honestly, the fact that Lynn sells. Like it's funny, and just in speaking with leaders at these organizations, um, there are some phenomenal human recruiters out there, but there are also some of the busiest people at an organization. And so sometimes there isn't enough time there's time to screen, right? But you don't have
Yeah.
time to like sell the organization. I use the word sell, but just to be direct, like it's not just about sharing. Um, and I think it's really cool that Lynn can highlight the employee value prop And some of these organizations are amazing. I mean, they're mission oriented. They've got amazing career advancement programs. Like, there's some of the coolest places for nurses to work. And it's been awesome to be able to bring that to the front and center in the conversations that Lyn is having with healthcare workers.
Very cool. I do think that overall, just marketplaces in general, career marketplaces are going toward this type of thing where you have the agents, because AI can screen everybody and not leave anyone out. And I think that's going to be part of the future of hiring. Would you agree?
That's absolutely right. We're also designing Lyn in a way where you can use Lyn with the incredible health market, with the talent coming from the incredible health marketplace. But you can also use Lyn with all of your nurse applicants, regardless of source. And that's where the ATS integration piece comes in too. And so I guess the business case and ROI for this for Lyn gets even stronger once you're using it with all of your nurse applicants.
Yep. What's the grand vision here, Iman? Do you have dreams of going beyond, nurses and reaching other parts of the clinical staff?
Yeah, absolutely. So the vision of the company is to help healthcare professionals live better lives, and the mission is to help them find and do their best work. And so because of our vision and mission, we can't just stop at nurses. So we've expanded to allied health professions this year. We've also expanded beyond acute care hospitals in 2025 to surgery centers, to home health organizations. For Lyn and Gale, we are working on expanding it from nurses to, which means, RNs, NPs, nurses, both staff nurses and nurse leaders. So we're working on expanding it to allied health professions, to physicians, essentially all the clinical roles, because we think we can have an impact on all those different professions.
Yep. You guys hiring?
Yeah, almost always are hiring for our team. So machine learning engineers is definitely, and just to keep accelerating our AI work is definitely a hot
Yeah.
role that we
You
have.
have a
Um,
fairly good sales team, big sales team, or how do you approach the market here in terms of marketing the tool?
Yeah, I mean, we have a combination of marketing and sales here, but it's really we rely on the product to sell itself too. So
It's
we're
always
big
a good thing to have.
demos. Yeah, we're big believers in demos and all of that, and the product needs to be really, really strong. But yes, we have a direct sales team. We do quite a lot of marketing as well, do PR too. Yeah,
Nice. All right. Well, it's Iman Abuzeid from Incredible Health, incrediblehealth.com.
that's right. It's incrediblehealth.com, and anyone's welcome to reach out to us on LinkedIn, on Twitter, and so happy to chat with anyone who's interested.
Well, I really appreciate your time today, Iman. It was a great conversation. I learned a lot about healthcare recruiting and nurse recruiting that I didn't before. So I appreciate you dropping the knowledge there. And have yourself a great day. And thanks for joining us here on RecTech.
Thank you so much, Chris. I appreciate it.
That will do for this episode of the RecTech podcast. Thanks again to Jobcase and Dahlia for sponsoring the show. Be sure to follow myself and RecTech Media on LinkedIn. See every podcast, video, and blog we publish. Thanks for tuning in, everyone. And remember, always be recruiting.